it's Anthony Carey, founder of Function First, creator of the Pain-Free Movement Specialist, and inventor of the Cortex. Today we're going to talk a little bit about one of the biggest pieces of information that constantly challenges those of you out there when it comes to corrective exercise, and particularly working with the chronic pain, is program design and where to start. So what I would like to first begin with is let you know that we are talking within the context of the chronic pain client. This is somebody cleared for exercise, probably already has had physio treatment or chiropractic treatment, has been released from a treating medical professional and needs to exercise. Very often these individuals are looking for the ability to move better and feel better and function better, and that's where we come into play. This is not about the healthy 40-year-old that's ready to start working out for the first time, and that we don't want to make that mistake of getting tied up in corrective exercises forever when this person just wants to move. This is in the context of that very unique biopsychosocial model related to corrective exercise and working with that person in chronic pain. So remember, we're not looking for perfection in the exercises that we create for these people. We're looking to reduce mechanical stress, improve movement efficiency with what we're doing. So as we approach the information that we gathered, you've done your assessments, and we're not going to go into assessments today because there's so many out there that can be done, but let's just say that we've done at least 4 movement assessments on our clients, which is what we typically do. At the very minimum, we're going to look at their posture, we're going to look at overhead squat, we're going to look at their single leg stance, and we're going to look at their gait. We're usually going to include rotational excursion. We'll do some other things as well as we tweak them out, but let's just say that we've done that. And with all the information that we've gathered through them, through those assessments, what we ultimately find out is that we have several big rocks that are reoccurring. Okay, and in this instance, we're going to say, that in the postural assessment, we saw some obliquity in the pelvis and possibly a little asymmetry in the A to P position of the pelvis. We're going to say in their single leg squat, when they're on their right leg, same side where we saw that obliquity, they had poor frontal plane stabilization. That same thing showed up in their gait. In their squat, they had an asymmetrical weight shift. And in the rotation excursion, we also saw some instability within that right hip. Now that's on top of everything else, but this is a recurring theme. This is where we're going to apply the 80-20 principle, which is one of our key components to what we do. We're going to get 80% of our results from 20% of our input, okay? So once we have that information, we're going to say we're not going to worry about all that peripheral stuff. We are going to focus primarily on what's going on with that right hip, because we know that we can have a positive cascade and influence over the overall movement system if we address those big rocks, okay? Now remember, we're not trying to give exercises that are there to address symptoms. We are looking what's going on. At the same time, we don't want to provide exercises that provoke symptoms. We want to stay away from that as well. We want to avoid trying to give an exercise for everything that we see in these assessments, because a lot of this stuff, we don't know if it's cause or effect, but we do know that we want to improve the mechanical efficiency and movement confidence of this client. So once we have all that data, this is where we know we can begin. We have our target, we have our major objectives, our big rocks that we want to address. From there, of course, now we have to look at how important the sequencing is and the right exercises to apply to that. But at least we've taken all that information and we've condensed it down using the 80-20 principle so that we have a starting point from where to move forward with our program design, and we don't feel that tremendous amount of overwhelm. Thanks for listening. I'm Anthony Carey with the Pain-Free Movement Specialist.